It shows that it's being live streamed,
Yes,
ma'am.
yes, it is live streamed. Okay. So now we are live. I will mute it and then I will leave. Okay. I won't leave. I'll just be around.
Sure. Sure, ma'am.
Yeah.
Yes,
Okay.
ma'am.
All right. All the best, guys.
Thank you. Bye.
Bye.
Christy, do you want me to wait for 10 minutes before starting?
Let's wait for another 5 minutes and then we'll start.
Sounds good.
Hi, somebody just asked about the certificate. So this is not a workshop, ma'am. This is our regular webinar series that we have end of the month, every last Friday of the month. So for this, we don't have any certificates that are being provided. I think you're probably asking about the other workshop that we are planning next month, which will be starting on 4th. For that, you'll be getting certificates. Shritya, I think we can start. And also, if you can keep letting people in while I'm presenting. I don't know how strong our ma'am's connection is.
Definitely, I'll do that.
Okay. Thank you.
Okay. Good evening, everyone. We are delighted to welcome Ms. Christy Bora, an RCI registered clinical psychologist and gold medalist in MPhil, clinical psychology. She currently works as a clinical psychologist at Summit Psychological Services, Bangalore, where she provides psychological assessments, evidence based therapeutic interventions for children and adults with a wide range of mental health concerns. Ms. Bora has an extensive clinical experience across hospitals, rehabilitation centers, and online mental health platforms. Her work focuses on creating a compassionate, safe, and non judgmental therapeutic space that empowers individuals towards growth and meaningful change. She has worked extensively with neurodevelopmental conditions, anxiety disorders, personality disorders, mood disorders, behavioral concerns, and emotional difficulties among both children and adults. In addition to her clinical expertise, she also has contributed to research in areas such as stress, aggression, moral judgment, working memory, and cognition. Known for her empathetic and client centered approach, Ms. Bora strongly believes in ethical, evidence based mental health care and helping individuals recognize their resilience and potential for change. Please join me in warmly welcoming Ms. Christie. Over to you, ma'am.
Thank you so much, Srividya, for your kind words. Please let me know if you can see my screen now, okay?
We can, but it's still black. Yes, we can probably properly see it now.
Okay, great. Is it visible now?
Yes.
Great. Mm. Let me know if anytime while I'm presenting, the presentation is not visible, okay? All right. So, good evening, everyone, and welcome back to our webinar series on personality disorders. I don't know if all of you were part of our previous personality disorder series presentation. This is the third one that we're doing on personality disorders. This is like the final piece of the three-part journey that we were covering. And in the first two sessions, we explored the different ways in which personality patterns can protect or adapt to the world. And we started off with cluster A, what we call cluster A personality disorders, which we describe as odd or eccentric patterns of behaviors where individuals often feel deeply suspicious of the world around them or prefer to be completely isolated. Then in the second series, we looked at cluster B, which is described as the dramatic, emotional, or erratic patterns of personalities, where they lean into high intensity or intense emotional waves and turbulent relationships. So today we will be doing cluster C personality disorders, which are described as anxious and fearful patterns in personality disorders. So if A was about suspicion, B about intensity, C is entirely about anxiety and fear. So before we start the session, the topic, like I've written down here, is it says unraveling anxious and fearful patterns in personality disorders, right? So the word unraveling is important here because personality disorders are often misunderstood. People are sometimes labeled as difficult, controlling, needy, shy, or overly sensitive without understanding the deeper fears that are driving those behaviors. So, cluster C personality disorders are largely organized into around anxiety and a fear of rejection, fear of abandonment, fear of losing control is something that is common to these individuals. So these are patterns where individuals cope with life through extreme caution and overwhelming need for safety and an intense drive for perfection. So, throughout this webinar, I would like us to focus not just on symptoms, but understanding the human experience underneath them. All right, so moving on. So, before discussing personality disorders, we first need to understand what personality is. So, here you can see in my slide, personality refers to the unique ways in which a person thinks, feels, behaves, and adapts to life situations. Okay, so it shapes how people respond to their internal as well as their external environments. So these are consistent ways in which a person thinks, feels, or behaves and relates to others over time. So for example, if I have to ask you to think of how you would describe yourself. So some of you might describe yourself as quite outgoing. Some might describe yourself as cautious. Someone might say that I'm highly emotional. Someone might say that I'm very organized, right? So traits these traits become part of who we are, right? So that's what personality in general is. Now, personality disorder. Now, what is a personality disorder? A personality disorder develops when these personality patterns, which I was talking about just now, become very rigid, very long lasting, and harmful to the person's functioning or relationships, right? So, what happens when a personality pattern becomes a disorder is that in clinical terms, we describe it as egosyntonic or alloplastic. So I'm coming to that. So egosyntonic simply means that when a person has a personality disorder, their own behavior feels completely normal to them or completely right to them. So no matter how much you tell them that this is not the right way of thinking, you should maybe think in different manner, they would not agree to it. So they feel that their way is the only way, right? And if they are intensely anxious or controlling, they don't think that something is wrong with my outlook. Instead, they experience alloplastic thinking. So alloplastic thinking is nothing but it means that they believe that the outside world is the problem or the people around them are the problem. So they try really hard to change the environment rather than their own actions, right? So this is why someone dealing with a sudden wave of okay, so unlike someone dealing with a sudden wave of depression or anxiety, who knows that they are going through something severe or they're hurting, they would want immediate relief. But people with personality disorders, they often don't realize their own habits are causing them harm or making them much, and that is what makes them much less likely to seek help, right? So that is about what personality is and what how personality disorders are different from just personality traits. Moving on. So today, like I said, we'll be discussing cluster C personality disorders, right? So the core feature here is pervasive patterns of anxiety. There's a lot of fear, and there are a lot of maladaptive coping strategies that these individuals get into, which ends up making their life very difficult or making the lives of other people around them very difficult. So there is this common thread between these three disorders is severe anxiety and fear. Okay. So firstly, avoidant personality, I'll discuss each one of them in detail. I'm just briefly showing you uh, giving you an idea of the disorders. First one is avoidant personality disorder, where they become extremely sensitive to rejection and criticism, leading to social withdrawal and avoidance of interpersonal contact altogether with anyone around them, right? Second is dependent personality disorder, where there's an excessive need to depend on others with difficulty making independent decisions. On their own, they're not able to make decisions and they fear abandonment to a great extent. Third is going to be obsessive compulsive personality disorder, which is also known as anarchistic personality disorder, where there's an excessive preoccupation with perfection, order, control, and they have rigid and very inflexible thinking patterns. So we'll be focusing on the first one of these, that is the avoidant personality disorder. So the core feature here when it comes to avoidant personality disorder is extreme sensitivity to rejection and criticism. So if you come across a person who has these symptoms of avoidant personality disorder, so outwardly it may look like they're very shy, they're timid, they're socially very anxious, and they might have a strong desire for relationship, but because of their fear of rejection, they would not approach relationships or friendships that way. So they would also be very low on self confidence, self esteem, and would avoid speaking in public or making any request in public. So very often you will see them that probably they might have ordered something in a restaurant, and they realize after ordering that the order that they received is the wrong order. So they will be very hesitant to make that request of changing that order. Maybe these are ways in which it might show up. So they will also misinterpret comments as criticism very frequently. So any comment that is a little critical maybe would be seen as a highly critical comment or a ridicule of sorts. So they also withdraw easily. I'm not sounds there. Okay. Okay. In terms of work and relationships for these individuals, they prefer very low profile jobs, often um, avoiding leadership roles altogether, and rarely forming any close friendships unless acceptance to them feels guaranteed. So they would only get into friendships or relationships when where they know that they will not be judged and they will be accepted no matter what, right? So when these individuals come for clinical interviews, let's say when they come to a psychologist or a psychiatrist, they may appear very nervous and tense. They're constantly worried about being disliked. Even in that situation, they're constantly seeing, any feedback as criticism. These are ways in which you would, notice these behaviors. So one thing about them is that they deeply want connection, but they fear rejection so intensely that they avoid situations where rejection could happen. So this is not simple shyness, because many people are shy initially, but gradually they warm up, right? But people with avoidant personality disorder, the fear becomes pervasive, becomes long lasting, and it starts affecting most areas of their lives. Like, they will start avoiding friendships, avoiding public speaking, even avoiding dating, avoiding any opportunities that comes their way because criticism to them feels emotionally devastating of sorts. So they're often hyper alert to signs of rejection. So even like I was mentioning earlier, neutral comments may also be interpreted as criticism to them. So they would end up choosing these low profile jobs where they won't be noticed. They will often turn down promotions because leadership would mean that they're being evaluated. So these are ways in which the characteristics might show up. So a lot of times these individuals internally, there's a struggle that's going on in their thoughts. They would be having thoughts like, I'm inadequate, or people will judge me, I will embarrass myself. So over time, avoidance temporarily reduces anxiety, but it also increases their loneliness and keeps reinforcing their low self-esteem that they had. Okay, so moving to the next one is dependent personality disorder. Here again, the core feature is excessive need to depend on others. So when it comes to, looking at their characteristics, the main characteristics that you or any person might be able to notice is they would have difficulty making decisions independently without, discussing it with some other person. There'll be a constant need um, for advice and reassurance. They would fear responsibility and leadership roles. They would be excessively submissive and very compliant to whatever instructions are given or any order that is given to them. They would also lack self-confidence and self-reliance, and they have a very strong fear of being alone. So relationships and how it looks like, these characteristics, what would it would look like in relationships, that is that they become overly attached to others, may continue to stay in unhealthy or abusive relationships to avoid the fear of abandonment. So they would extremely be dependent on that person and would completely avoid coming out of a negative relationship or a abusive relationship because they fear the abandonment so much. So they will be passive and pessimistic in their views, and self-doubt and fear of expressing anger or sexuality is also very common. Right? So in interviews, their behaviors might look like cooperative and compliant, and they might look to the interviewer at times to, for the interviewer to provide them with guidance and direction. Right? So one difference between the dependent personalities and avoidant personality is that if the avoidant pattern stays away to protect themselves, the dependent pattern clings on to the person for survival in a way, right? So this is like a core difference, and the major feature here is to like is the overwhelming need for them to be taken care of. So with these individuals, they feel completely helpless when it comes to making independent decisions of their own. They might need constant reassurance just to decide what clothes to buy or what to eat because they are terrified of being abandoned, like I said. So they like I was mentioning earlier that they're overly compliant and submissive as well, right? So agreeing to everything that a partner or a parent says. So tragically, what happens is this fear of being alone means they are at a very high risk of staying in unhealthy, manipulative, or even abusive relationship because to them being mistreated is less terrifying than being abandoned. Right. So this is how a dependent personality disorders, individual with dependent personality disorders traits might show up in real life settings. Next, we come to the third um, disorder, that is obsessive compulsive personality disorder, also known as an ankestic personality disorder. So the core feature here is a preoccupation with perfection, order, and control. So you would start noticing these characteristics in these people, like they excessively focus on rules, details, and organization of a task, right? They would be very rigid and inflexible in their thinking. Even if you try to show them a different way of doing a particular task, they would stick to their way of doing it, right? So they have very high, they have a lot of difficulty when it comes to adapting to any change around them. So they are very used to doing things their way. So any change that comes about their way, it's something they find highly challenging. And they're highly perfectionistic, and are indecisive also. So they fear making mistakes so much that they stick to their ways of doing things and feel that that is the only way. And when it comes to their temperament, they're like very serious and formal when it comes to talking to individuals. When it comes to relationships and work and emotions, they have difficulty compromising with others. They have limited social relationships, often very hardworking and reliable in structured environments. But anxiety increases when routines are disrupted in their life. So they need to stay in control at all times. So their behaviors during these clinical interviews might appear like they're quite formal, they're stiff, they're highly detailed in their responses, and their mood seems to be very serious and with very limited spontaneity present, and may feel anxious even during interview settings if they're not in control. So control is used as a shield against uncertainty by these individuals. So they feel that if they can make enough rules or organize schedules perfectly and double check every single detail while doing a task, they can not go wrong. Nothing can go wrong about that. So they're, like I said, formal, serious, and rigid. So any change in their plans, they are immensely struggle with that. So they're like I mentioned, they are so terrified of making a mistake that they can become completely sort of paralyzed when trying to make a decision sometimes. And in relationship, another thing that might show up is like that they find it so hard to compromise because they sincerely believe that there is only one right way of doing things. So that's when in relationships also they come in situations that where they're getting into a lot of conflicts with their partners, and all these things might show up. um then they right so there was one more thing about uh, obsessive compulsive personality disorder, that their perfectionism is to such an extreme extent that it interferes with their functioning to a great extent. So for example, in work settings, they might have difficulty delegating the tasks or giving tasks to others, or they just want to keep the entire task to themselves so that they know that whatever they are doing is going to be right. So they end up overworking, sometimes missing deadlines because they want it to be perfect. So and the relationship conflict is something I have described already. All right, so these are common defense mechanisms used in persons with obsessive compulsive personality disorders, but I'm going to talk about this in detail in the later slides. Okay, so up next, these are differential diagnosis of avoidant personality disorders. So um, it's basically how clinically one disorder might look similar to another disorder on the surface. So avoidant personality disorder sometimes look similar to other disorders, such as social anxiety disorder, where but in social anxiety disorder, the fear is limited to specific social situations, whereas in avoidant personality disorder, fear affects most of their interpersonal relationships, and they're unable to differentiate. So both conditions sometimes may occur together, but these are two different conditions. Next is panic disorder with agoraphobia. Agoraphobia is a phobia of not being able to escape situations, or being in closed spaces, not being able to come out of closed spaces. That is the phobia called agoraphobia, which also individuals who suffer from agoraphobia also have panic symptoms, panic attacks that they suffer with. But the avoidance in agoraphobia happens only after panic attacks begin, whereas in avoidant personality disorder, the avoidance is mainly due to the fear of rejection and criticism, not because of their, avoiding the place. Then comes schizoid and schizotypal personality disorders, where pre- the individuals who have these disorders, they prefer to be alone. But in avoidant personality disorder, they want relationships, but they are so afraid that they might be rejected that they do not get into relationships. Then there's borderline and histrionic personality disorders, which might have similar traits with avoidant personality disorders sometimes. But individuals with APD, they are usually less dramatic, demanding, or emotionally unpredictable that compared to borderline and histrionic personality disorders. Then dependent personality disorders. Both of these disorders show insecurity and dependence, but dependent PD mainly fears abandonment and being unloved compared to anxious abandonment. Next up is differential diagnosis of dependent personality disorder. So, compared to histrionic and borderline personality disorders, if we look at this, dependence may occur in both of these disorders, but when it comes to dependent personality disorders, they are usually dependent on one person or one long-term relationship throughout their life, and they are less manipulative compared to the other two kinds of personality. Um, then anxiety and depressive disorders, if we compare it with dependent personality, dependent behavior can occur in agoraphobia and panic disorder and depression as well, but these disorders show more obvious symptoms of anxiety, panic, or depression as the primary presentation. So the intensity of these symptoms will be so much compared to the dependency of the personality traits. Up next is obsessive compulsive personality disorders differential diagnosis, wherein first off we have obsessive compulsive disorder. This is something you must have heard of a lot. Um, that I have these tendencies, or I have these traits that I keep cleaning all the time, or I keep organizing all the time, or my mother keeps organizing all the time, that she has OCD, right? So let's talk about how these two disorders are different. They sound almost identical, but they are like immensely, profoundly different, right? So OCD is an anxiety disorder where it includes true obsessions and compulsions, which is basically intrusive, unwanted thoughts, which are paired with repetitive actions like, it could be like a fear of germs, and they prefer repetitive actions like, let's say, washing hands 50 times just to. Can
Christy, we lost you in the middle over there.
you hear me now?
Yes. If you could repeat the last part.
Like a fear of germs, and they perform these repetitive actions to deal with that fear. Like they could wash their hands 50 times just to make that distress of those unwanted thoughts go away. So they absolutely hate or are immensely affected by these thoughts, and they wish that they would stop. But OCPD, obsessive compulsive personality disorder, mainly involves perfectionism, rigidity, and need for control experienced as a part of self, not as intrusive. So that is the key difference here. So a person with obsessive compulsive personality disorder will not see these thoughts as intrusive at all. So they would happily organize, happily, you know, um, believe that their high standards or rigid rules and extreme organization are absolutely correct way of living their life. So they don't feel tortured at all by their rules. They feel proud of them in a way, and they think that everyone else needs to step up to their level in a way. Now, next is obsessive traits versus OCPD. So, obsessive traits are nothing but just having certain, traits that they strongly feel and they want to continue in their life, and they do not constitute OCPD. This diagnosis is only made when the traits significantly affect their relationships or their daily functioning. Then delusional disorders. These two disorders may occur sometimes, but delusional disorders are a very unshakable, irrational belief about something, whereas in OCPD, it's not completely irrational. Okay, now we've discussed these conditions in detail so much, so I thought maybe we'll look at a more case so that we understand the condition in a more practical way. So the first case here, I hope everyone is able to see my screen. So I'll read it out. Priya is technically excellent and gets praised in performance reviews, But she has never spoken up in a team meeting. She skips the office lunch even when she's hungry because she's convinced she'll say something awkward and people will think she's stupid. And when her manager suggested she present all at the all hands meeting, she called in sick that day. So I think everyone would be able to understand which disorder this looks like. So it looks like avoidant personality disorder, right? So let us look at what it looks like in Priya's head. So what it sounds like in her head, right? So if so in this example that I read, right? So to her it might look like if I speak and say something wrong, everyone will realize that I don't belong here. These are the kinds of thoughts that you can visit, the individuals usually go through. So the visible behaviors here would look like avoiding meetings, social events, any situation where she might be evaluated, turning down promotions, high visibility projects. It's not laziness, but it's just that fear, intense fear of being judged. So she would also have a very few close friends, would want connection deeply but can't risk the vulnerability of it. So that is what an avoidant personality disorder might look like in a real life scenario. The second case is Rahul. He has never been single for more than 2 weeks. His last relationship was unhealthy. His partner was controlling, but he stayed 3 years because the idea of being left alone was unbearable. When it finally ended, he started a new relationship within days with someone he barely knew. He's described as clingy by partners and friends, but it comes from terror, not neediness in the ordinary sense. So, as you must have heard now, what this might sound inside Rahul's head. Now, let's look at that. So, for him, it might be the outwardly, it looks like, okay, this is a very clingy person. He's not able to be on his own. He gets into relationships even after just breaking up with a person, right? But to him, this is what it looks like. I can't function without someone to lean on. What if something goes wrong and there's no one there? This is the extent to which they feel the intensity of these emotions, right? Again, they might feel if I upset him, he might leave me. I should just go along with it. So these are the kind of thoughts and anxious, an avoidant personality disorder individual might have. Sorry, dependent personality disorder individual might have. So DPD often leads people to get into exploitative relationships because keeping the relationship feels more important than keeping themselves safe because they absolutely fear abandonment. Now, the third case is of Vikram's. So, Vikram's team submitted a report on Friday. He spent the weekend rewriting it entirely, not because it was wrong, but because the formatting wasn't to his standard. He cannot delegate because no one does it the right way. 3 members of his team quit this year. He himself misses deadlines because he can't submit anything he considers imperfect. His manager has pointed out that a submitted 90% is better than a perfect 60%, but he still cannot commit. Okay. So let's look at what it sounds like in Vikram's head now. If I let something go out imperfect, it reflects on me, on my values. So this is how deeply ingrained it is inside that person's mind that it's to this extent that they are bothered by imperfection. Another way of looking at it is that you might feel why can't people just do it properly? It's not that hard. This is the kind of statements that goes through an OCPD, an individual with OCPD. So the visible behaviors here would look like rewriting others' work, micromanages every detail in work setups, and struggles to delegate tasks, which we were talking about earlier. So they um, miss the big picture of things because they are lost in the minor details of the task. And they find it very difficult to throw away old files, objects, or worn out items. They feel that they might need them in the future, so they end up keeping them. Unlike just earlier we were discussing the difference between OCD and OCPD. So here Bikram doesn't think his standards are a problem. He thinks everyone else is the problem, right? This is what ecosyntonic thinking looks like, which I was telling in the very first slide, where it feels right to him, which is why OCPD becomes very difficult to treat because for the individual it doesn't seem like a problem at all. Okay. Next up, we talk about comorbidity. Comorbidity is nothing but when different conditions or different disorders occur together, right? So is when we call it comorbidity. Earlier we were talking about differential diagnosis, how two disorders can be different from each other. Now comorbidity is when with one person with disorder, another disorder can also coexist. So when it comes to avoidant personality disorder, commonly associated conditions with avoidant personality disorder is mood disorders. So the constant stress of isolation often invites a lot of mental health struggles for them. So they're highly likely to experience clinical depression. That is one of the mood disorders that we talk about. Severe anxiety disorders or somatic symptoms. So, somatic symptoms is when deep emotional anxiety turns into real physical issues like chronic stomach aches or headaches or muscle tension, all of those things. Other core occurring personality disorders with avoidant personality disorder could be schizoid, schizotypal, paranoid, dependent, and borderline, which we were discussing earlier. Now, next, comorbidity of dependent personality disorder. For individuals with dependent personality disorder, their emotional health is completely tied to the person they lean on or they are dependent on, right? So, because of this vulnerability, when they frequently experience major depression and very high anxiety. So, they are also highly prone to adjustment disorder, which means if a major relationship ends or if a caregiver, let's say, passes away, their psychological system goes into sort of a crisis mode or a massive crisis because their primary anchor is gone. Again, for them also, somatic symptom disorder is a very commonly occurring disorder. And other personality disorders could include histrionic personality, avoidant, and borderline personality. The last comorbidity for obsessive compulsive personality disorder. So, for individuals with OCPD, the constant pressure of trying to be flawless eventually leads their system to crack. So, these individuals frequently experience burnout, um, anxiety, and severe depression when life becomes an inevitable mess and they realize that they cannot control everything. While OCPD and OCD are different, a person can occasionally carry both patterns at the same time, which requires a very careful assessment for us to, be sure of. Okay, next we are going to talk about course and prognosis of personality disorders and then specific to these personality disorders. Prognosis is basically a medically informed prediction about the likely future course and outcome of the disease or the condition. So, personality disorders are typically very chronic and long lasting, often interfering significantly with a lot of domains of an individual's life. So, chronic course is one trait of personality disorder where it persists over time and are resistant to change without targeted intervention. It's not provided. Next is social difficulties, a lot of interpersonal conflicts, marital problems, and difficulty in maintaining stable relationships are pretty common with personality disorders. Occupational impact also is a very strong feature. That is, they might have difficulty sustaining employment, go through unemployment, and this is a frequent trend among cluster C personality disorders that we are discussing. Another feature is substance dependence, that is depending on a drug or alcohol. So co-occurring substance use disorders are a significant risk for these individuals because they tend to use these maladaptive coping mechanisms a lot. Now, focusing on each of these disorders, course and prognosis. Firstly, starting with avoidant personality disorder. So the roots are almost always traced back to early childhood. For when we look at the course, parents often remember the child as being, intensely shy, deeply terrified of strangers, or throwing tantrums when they are introduced to a new environment. So they're very, very afraid of new situations. So these are early signs that show up, and as they grow into adults, these traits become strong and intensify into a permanent lifestyle of staying hidden of sorts. So if a person with avoidant personality disorder traits has a very gentle or protective family, they can sometimes look like they're doing well, but if that supportive environment or that bubble sort of is suddenly lost, like moving away for college or losing a parent, they then fall into a severe crisis of depression or panic disorder is something that it looks like. So prognosis wise, they have a lot of difficulty socially and occupationally, and it might be severely affected. They sometimes function well when they have supportive and family environments, like I said, but without that, they might have these conditions of depression, anxiety, and a lot of anger as well. Then dependent personality disorder. So with DPD, the long-term picture shows a lifetime of relying heavily on others, and they struggle to work in jobs unless they have a, let's say, supervisor constantly telling them exactly what to do step by step. This is how they struggle in their occupational domain, and their biggest risk is emotional or physical vulnerability in relationships. So their um, loss of a support person may trigger major depression for them as well. However, their long term outlook improves with psychotherapy because their submissive nature actually makes them very cooperative clients who are willing to work hard in therapy and learn self reliance on their own. So this is something that is a protective factor for them. Right. So up next, OCPD scores and prognosis. So in certain parts of their life, this the patterns of behaviors or the patterns of thinking that an individual with OCPD has, it might look like a superpower for them because they excel in highly structured and detail oriented careers like, for example, accounting, engineering, or data analysis. These are careers where they will do really well. But the crisis for them hits when life demands flexibility of sorts. If their organization, let's say, undergoes some changes, some restructuring, or if their household routine is disrupted by some changes in the family dynamics, let's say a baby, their internal stress then um, increase a lot, and it puts them in a very elevated risk for severe health issues or depression or anxiety as well. Okay, so a quick summary of what we have discussed so far. So for avoidant personality disorder, the main fear that we usually notice is a fear of rejection, and the common comorbidities that are there that occur with avoidant personality disorder could be anxiety disorder, depression, and the major area of difficulty where what they face is the is about social interaction. So this is about avoidant personality disorder. Dependent personality disorder again. The main fear is abandonment. Comorbidities can include anxiety and depression. And the key difficulty here is independent functioning. So they're not able to function independently or make decisions on their own. OCPD, on the other hand, the main fear is a loss of control, and the major difficulty is flexibility and not being perfect, right? So the common comorbidities here again would be anxiety and depression. So to summarize, avoidant personality disorders, they would want connection, but they fear rejection. So they withdraw before they could even be, or they can be hurt. In dependent personality disorder, they seek closeness to avoid abandonment and surrenders their autonomy completely for security. In OCPD, they maintain control through perfection, and rigidity is used as a shield against the uncertainty. Okay, now let's talk about. So, we've discussed in detail about how this might show up, how the traits show up in real life. Now, let's talk about why does this happen? What is the root cause behind it? First is the heritability factor, which means that there's a strong biological blueprint when it comes to personality disorder. Research studies have shown that cluster C traits are highly heritable, meaning that they run strongly in family genetics. So, in fact, OCPD, like you can see, shows the highest heritability, which is 65% of all personality disorders. Then comes temperament. So, in the first uh, point, behavioral inhibition that you can see that it talks about. So, it's nothing but children who show a specific temperament where their nervous system is naturally highly sensitive or easily frightened by loud noises, and they're intensely cautious around new faces or new toys. This is something that is commonly seen with individuals who develop personality disorders in adulthood. Another temperament trait that is frequent among individuals with cluster C profiles is high harm avoidance and low novelty seeking. So they tend to avoid situations or try anything new where they feel that something might cause them harm. So they would preferably avoid it so that they can be safe. So that's one, and low novelty seeking. So they would not want to try anything new, right? So this is also commonly seen. So if we talk about neurobiological correlates, the first one is the dysregulation of the HPA axis. So the HPA axis, it's stands for the hypothalamic pituitary adrenal axis. So it is basically the body's stress response system. So it's the system that gets activated when we sense any form of danger in our life. It releases hormones like cortisol to help us react quickly and stay alert. So you must have heard about the hormone cortisol, right? So in individuals with avoidant personality disorder, this system becomes overactive. So their brain may react to social situations or criticism or rejection as embarrassment, or embarrassment, let's say, as if they're real threats. So even simple interactions can trigger intense anxiety or tension, or they might be sweating, overthinking, or an urge to avoid the situation is something that shows up. Next, altered amygdala reactivity and heightened threat detection circuits. So the amygdala, which is the brain's fear and threat detection center, is also found to be more reactive in anxious personality disorders. So this means that the brain becomes highly sensitive to the possible rejection or judgment. So, for example, like I was discussing earlier, a neutral expression may feel critical to them. Delayed replies or responses may feel like it's rejection to them, or a small criticism may feel very overwhelming to them. So it's like having a smoke alarm in your brain that goes off even when there's no real fire of sorts. This is how it looks like. Up next is attachment and early relational factors. So, individuals who develop cluster C personality disorders, a lot of research studies have proved that insecure attachment it is strongly associated with cluster C development. So, when it comes to avoidant personality disorder, their childhood usually looks like their parents were cold, rejecting, or shaming. There were early experiences of shame that they went through, humiliation, or a very chronic environment of criticism that was present, is what we usually see. And also with the presence of childhood bullying and peer rejection, that is pretty common with individuals who develop avoidant personality disorders in adulthood. Dependent personality disorder, common early relational factors look like overprotective or very infantilizing parenting, where their parents would not even let them explore anything on their own. They the parents would step in and do absolutely everything for the child, never letting them make any mistakes or try things alone, which in a way teaches the child eventually that you are weak and you cannot function without me in a way. Right? So that stops their autonomy development, and then this in a way turns into excessive reliance on others, and their independent functioning is then stopped. So when it comes to OCPD, uh, child usually grows up with highly authoritarian parents where love and approval feel completely conditional to them, and um, conditional on their flawless performance. They have to be perfect in everything. Only then they would be able to, receive the love and affection from their parents. So, emotionally withholding parenting is also something. The parents are not emotionally, showing them affection is also something that we usually see with individuals who eventually develop OCPD in their adulthood. Next up is adverse childhood experiences, or ACE, or social and environmental factors. So, adverse childhood experiences might include emotional neglect, chronic invalidation from their major, support systems, and they are linked to cluster C personality disorders. Childhood bullying and peer rejection again comes under adverse childhood experiences. Social and environmental factors also include cultures where which emphasize on conformity and shame avoidance and collectivism, and that may amplify cluster C traits again. Chronic social stress also um, leads to development of OCPD traits and avoidant personality traits as well. Socioeconomic adversity also leads to development of cluster C personalities. Okay, now let's talk about briefly about defense mechanisms of cluster C personality disorders. Now, defense mechanisms are unconscious psychological strategies that the mind uses to protect us from any situation that causes us anxiety or any distressing thoughts and threats to our self-esteem. So some of them are mentioned here. I'm not going to go into detail because we don't have a lot of time. So avoidance is one where the core function is behaviorally withdrawing from situations where some shame, rejection, or humiliation could be triggered. So how it might show up is declining job promotions, like I was saying earlier, to avoid evaluation, refusing social invitations as well. Intellectualization is abstracting emotional content from experience to manage their anxiety, using reason to avoid feeling a feeling. Okay, so they would analyze a relationship breakdown through logic while denying grief, over researching minor decisions. This is how it might show up. Then reaction form action. this means converting an unacceptable impulse of their own, like let's say aggression, into its opposite. So it might show up as extreme politeness, masking their anger or hostility. Okay? So this is how it might show up. Then undoing is another defense mechanism where performing a ritual or compensatory act to neutralize guilt or anxiety from a prior act or thought. So they will be rechecking locked doors repetitively or apologizing excessively after minor assertiveness. This is frequently seen in individuals with OCPD. Rationalization is one where they construct logical justifications to make unacceptable motives or behavior appear reasonable. So they would say things like, "I didn't go to the party because it was too far," or I need approval before deciding." These are ways in which I show up. Let's now move to the treatment. So, for the treatment approach for all sorts of personality disorders, specifically cluster C personality disorders, the major challenges are that the individuals do not realize that they have a problem, and they often seek help only when other areas of their life is getting affected, or when others point it out, and then they would like seek help. So one form of treatment is psychotherapy, which is considered as the main form of treatment, which helps individuals develop healthier coping skills, improve their relationship dynamics, manage their emotions more effectively. And pharmacotherapy, where medication is provided to reduce symptoms such as depression, anxiety, or any impulsive or self-destructive behaviors that come up. Now, for avoidant personality disorder, psychotherapy would focus on first building trust, establishing a very strong foundation of the therapeutic relationship with the therapist, and then gradually exposing the client to face social situations that are manageable at a very manageable pace. So starting off with easier ones and then moving on gradually once they are able to adapt. Group therapy, so that these individuals have a space where they feel comfortable to discuss their own challenges with people who are struggling with similar concerns. Then assertiveness training, which would help them improve their confidence and communication skills over time. And pharmacotherapy again would help with medications for any symptoms of anxiety and depression. For dependent personality disorder, psychotherapy would focus on fostering independence, self-reliance, and being able to make independent decision. Assertiveness training to build confidence and express needs and boundaries. Self-reliance, reducing excessive dependence on others for validation. And the kind of therapeutic techniques that I use are insight-oriented therapy, behavioral therapy, family therapy for the you know um, interpersonal deficits, and group therapy. So these people, they struggle when asked to change unhealthy relationships. So when it comes to handling these attachment issues, therapists have to be very careful. And pharmacotherapy again deals with any associated symptoms of anxiety, depression, or panic attacks, or any form of separation anxiety that might show up. Lastly, for obsessive compulsive personality disorder, um, many patients recognize their difficulties and they actively seek treatment. So, majorly, treatments include cognitive behavior therapy is a very effective form of therapy, where individuals are helped to challenge their black and white thinking, or all or nothing sort of thinking styles that they have. So they're helped on realizing that unexpected change in plans is not catastrophic, and that a project can be, let's say, completed at a 90%, and it's often healthier than and better than an unfinished project which is stuck at a 60%. Right? So that is one. Interpersonal therapy with them helps with the interpersonal struggles that they face because of their rigidity. All right, so that's about it. So as we conclude today's webinar, I would like to leave everyone with one message that personality disorders are not just bad behavior or flaws in general. They are deeply ingrained patterns that usually developed as ways of coping to deal with the fear or the uncertainty or insecurity or the emotional pain that the individuals are going through, which I was describing to you earlier. So behind avoidance is often the fear of humiliation. Behind dependency is a fear of abandonment. Behind the perfectionism tendencies is a fear of losing control or making mistakes. So, understanding these patterns with empathy does not excuse the harmful behavior, but it allows us to respond in much greater awareness and compassion. So, I hope you all will be able to remember that. And thank you for being part of the session.
Thank you, Christy, for such a wonderful session. Audience, we are now ready to take in any questions. If you all have any doubts or any questions, I would request you all to kindly put it in the chat box, or you all can unmute yourself and ask the question.
I think we have a question in the chat box. Some amount of OCD necessary in completing tasks in office or at home. Like I was describing earlier, OCD is a very severe anxiety disorder. So, no, nobody would benefit from having OCD because it's very difficult for them to deal with their um, intrusive thoughts. But if you are talking about organization, that is something that would be necessary in completing tasks in office or at home. So that is entirely different from OCD.
If you all have any other questions, I would request you all to kindly put it in the chat box, or you can unmute yourself and ask.
I don't think there are any questions, Arvamam.
Yes, if there are no further questions, then I think I can go ahead concluding the session. So, thank you everyone for being a part of today's session. We explored how these patterns influence emotions, relationships, behavior, and everyday functioning, while also understanding the importance of empathy, early identification, and appropriate therapeutic support. As professionals and learners, it becomes essential for us to approach such individuals with sensitivity, clinical understanding, and a non judgmental perspective. I hope today's discussion has provided meaningful insights and encouraged further reflection and learning in this area. Thank you once again for your active participation, thoughtful engagement, and valuable presence throughout the webinar. Before we conclude, I would also like to inform everyone that our next webinar session will be scheduled on the last Friday of the next month, that will be on 26th June. We look forward to having you join us once again for another insightful and engaging discussion. Further details regarding the topic will be shared soon. Thank you all once again for your participation and support. Have a wonderful evening ahead.
Thank you, madam.
Thank you.
Thank you.
It was a lovely session, Christy. It was really good.
I fumbled a little. Okay. I hope ma'am stopped the live
No,
stream.
it's on.
It's on.
It's still going on.
I can.
Just a second. That's what I'm doing right now.
Okay, sure.
Oh, okay, okay. Welcome.
Uh,